Have you ever been out hiking, seen a crystal clear mountain stream and thought, wow, that looks so pure I could drink it? Well, you might want to think again. Today, we're going to take a deep dive into the microscopic world to meet one of its most notorious residents, Giardia lamblia. It's this tiny parasite that causes a really nasty intestinal illness, and knowing how it operates is absolutely key to staying safe out there. Let's get into it.
So here's how we're going to break it all down. First, we'll look at the parasite's two different faces. Then, we'll trace its path from a stream right into your gut. We'll cover the symptoms, what to watch out for. Then we'll see how doctors pinpoint it, and finally, the big one, how to treat it, and even better, how to avoid it altogether. Alright, so to really get a handle on Giardia, you gotta understand that it's kind of like a secret agent. It has two totally different forms, two different life stages, and each one has a very specific job to do.
Okay, let's put an official name to it. We're talking about Giardia lamblia. It's a single-celled organism, a protozoan parasite. And when it gets inside a host, like us, it causes an illness called Giardiasis. You might have heard it called beaver fever.
And here are those two faces we were talking about. On one hand, you've got the cyst. Think of this as its armored travel pod. It's dormant, wrapped in a super tough wall, and its entire mission is just to survive out in the cold, harsh world, in water, in soil. This is the form that actually infects you. But once it gets inside you, it transforms into the trophozoite. This is the active invader. It's mobile. It's got these little tails called flagella to swim around, and its one and only job is to latch onto your intestine and make you sick. So how exactly does that little armored travel pod, the cyst, manage to get inside and start all this trouble? Well, the whole path of infection starts with something super simple and what seems totally harmless, like taking a drink of the wrong water. Okay, so this image shows the whole shebang. It all kicks off when someone or an animal swallows these dormant cysts. Maybe from water, maybe from food that's been contaminated. Once they hit your stomach, the acid acts like a key, telling them it's time to wake up. They hatch in the small intestine, becoming those active trophozoites. They multiply like crazy, stick to the gut wall, and eventually they get passed out in the stool, ready to start the whole cycle over again.
Now, here's a really important distinction. Giardia is not like some bacteria or viruses that actually invade your cells or get into your bloodstream. No, it's more like the worst roommate you can imagine. It has this little suction disc, and it just latches onto the lining of your intestine and refuses to leave.
So let's just walk through that one more time. Step 1, ingestion. You swallow the cysts. Step 2, excistation. That's the fancy word for hatching. Each cyst pops open and releases 2 active trophozoites. Step 3, attachment. Those little guys use their suction cups and stick to your intestinal wall. And that leads directly to step 4, malabsorption. Because they're there, they cause inflammation, and that just messes up your body's whole system for absorbing crucial nutrients like fat and protein.
Okay, so what does it actually feel like to have a colony of these microscopic squatters hanging out in your gut? As you can imagine, it's not pleasant, and the symptoms they cause are pretty unique.
The classic signs you're going to see are watery, but not bloody, diarrhea that has a really, really foul smell. That often goes along with nausea, a complete loss of appetite, a lot of gas, and stomach cramps. And this isn't a 24-hour bug. These symptoms can drag on for weeks or even months. But here's a really interesting clue for doctors. Unlike a lot of other infections, Giardiasis usually does not cause a fever.
So if you're feeling like that, you're obviously going to see a doctor. But how do they figure out for sure that Giardia is the culprit and not something else?
Well, the most straightforward way is to look for the evidence directly. They can do a stool examination, where a lab tech literally hunts for the cysts or the trophozoites under a microscope. A much more common and really effective method is something called an ELISA test, which is great at detecting little molecular pieces of the parasite in the stool. And for those tough cases where symptoms just won't go away but other tests are negative, they might use something called a string test, which is exactly what it sounds like, to get a sample directly from the gut.
All right, so we know what it is, we know what it does, and we know how to find it. Now we get to the most important part. What on earth do we do about it?
The good news is Giardiasis is definitely treatable. The go-to medication is called Metronidazole. It's an antibiotic that's very effective at clearing out those active trophozoites that are causing all the problems. But you know what's even better than treatment? Prevention. Not getting sick in the first place. The golden rules for water safety, especially if you're a camper or hiker, are pretty simple. 1. Boil your water. 2. Use a good water filter. 3. Treat your water with something like iodine tablets.
Okay, listen up, because this is probably the single most important takeaway. Standard chlorination does not kill Giardia cysts. That tough little shell on the travel pod we talked about, it makes it super resistant to chlorine. That's why even some city water systems can have outbreaks. You absolutely have to physically remove them, which means filtration is key.
And that brings us to this final, really critical point. As of right now, there is no vaccine to prevent Giardia. There's no pill you can take beforehand to keep from getting it. The only, and I mean only, real defense you have is making sure the water you drink is safe.
So, after our little journey into the world of this tiny but really powerful parasite, that pristine-looking stream might not look quite the same, huh? Now you know what could be lurking in there. So the real question is, what are you going to do to stay safe on your next adventure?